Hello, good day. My name is Urushetsume Narengo. I'm a PhD candidate at the University of Bristol, actually at the Center of Doctoral Training in Digital Health and Care in the Computer and Engineering Mathematics Department. And I'm the correspondent author who's presenting this paper, while the co-author, Dr. Korede Sanyaolu, is actually a master's student in the Digital Health and Care faculty still at the University of Bristol, and this is primarily a paper focused on providing digital health education. So this is a brief outline of what you're to expect from this discussion of what the paper is all about and this presentation. And I'm going to start with a brief introduction. I'm going to talk about the objectives of the paper. I'm going to talk about why the paper is relevant, and I'll discuss and tell you, okay, what health promotion is all about, digital health promotion, talk about fitness culture in Africa, discuss digital health interventions used by fitness enthusiasts in Africa. I would highlight limitations of the study and then give a conclusion and just flash my references so you can see where some of the references that appeared on the slides were actually called from. So this is a very interesting paper. It's a narrative review in the sense that most of the papers, the paper was focused on just extracting important corpus of literature from very good verified databases online to kind of communicate the objectives of the research, which I shall mention briefly, just to ensure that we're able to explain and highlight the importance of digital health promotion among recreational athletes in Africa. And there are just important keywords like we talk about digital health, fitness technologies, digital health promotion, and digital health education, which is primarily what I'm doing at this particular point in time. But then again, you might be wondering, what is digital health? Before I go ahead to talk about the objectives of the research, digital health or digital health and care is a broad interdisciplinary or multidisciplinary concept that includes concepts and different, fields that form an intersection between technology and healthcare. So it applies digital transformation to the field of healthcare by incorporating hardware, software, network services, and all of that. So under this umbrella, within this jurisdiction, digital health could include mobile health, electronic health records, the Internet of Things, wearable devices, telehealth, personalized medicines. There are a plethora of applications of technology within the field of health, and that is what digital health is all about. So the objectives of this paper would be to summarize digital health technologies that are being used by fitness enthusiasts in Africa and to highlight strategies for encouraging their adoption or the adoption of these digital health technologies by these fitness enthusiasts. And keynote, you have to understand this definition that we are focusing on fitness enthusiasts or recreational athletes. These are individuals or persons who actively go to the gymnasium or participate in, physical activities or sporting activities because they love it, because they are enthusiastic about being fit, not necessarily because they have a pre-existing disease condition. So this is actually very interesting because most literature would always talk about, talking about physical activity from the perspective of lifestyle modification, in the sense that, for example, a type 2 diabetes patient would be encouraged to actively lose weight because most of them might be obese, and then you see them going to the gymnasium and maybe incorporating the use of some of the technologies that we shall talk about. And this gives you a very interesting perspective. This narrative review that I'm about to talk about gives you a very interesting perspective because we're looking at it from a very different lens, from a very different view. We're looking at it from the perspective of a layman. We want to understand, what would an average person who just loves to work out use in the gym in Africa? Are they using any technologies? And if they are, what are they? Can we use these things to encourage them to be more active in the gym, or to dispel them from engaging in unhealthy practices because they want to meet unrealistic body standards. So this is like a whole different perspectives of looking at this particular paper. And then the secondary objective of this research will be to access relevant literature focused on health promotion and tech-related statistics and research with similar themes. And why is this paper relevant? What's the importance of this paper? The paper actually highlights ignored populations and other tech-related disparities. And when we're talking about ignored populations, we should understand that fitness enthusiasts or recreational athletes are rarely talked about in literature. Even in sports-related literature, they are hardly talked about. So this paper actually makes them very important because they represent a very useful percentage of the population in our today's world. And because if you look at our paper, if you look at the paper and you look at ongoing statistics, for example, a 2018 UK-based report said that at least 1 in 7 residents in the United Kingdom was a member of a gymnasium, and they didn't go to the gymnasium for the purpose of lifestyle modification associated to a pre-existing disease. They were working out because they were motivated to do so by maybe social media, or they just wanted to look good, personal preferences. So if 1 in 7 is a very significant number, and it's just interesting to note that literature actually doesn't focus on this particular population because it's assumed that they do not have pre-existing, conditions. They don't focus on them until something happens, because in order to, meet those unrealistic body goals, especially for individuals who are motivated or enthusiastic about engaging in recreation activities because they have idols that they see on social media, you find out they might be engaging in some unhealthy practices and taking steroids and other things that might be unhealthy for them. So how can we use digital health technologies to actually mitigate the possibility of these things happening? Instead of, talking about when it happens and saying, oh, there's a high use of steroids and all of that, and saying, oh, how can we use technology to, reduce steroid use? We could actually nip it from the board. And this narrative review brings to light this particular ignored population. And also, it brings African countries to the forefront of discussions on tech adoption and literacy. So there is very little research as well on the adoption of technologies, very poor statistics from African countries on digital health literacy. Are they using technologies to improve their health? Even if it's related to pre-existing conditions, we want to understand what is the status quo, what is happening, and maybe we can make comparisons with other countries and provide digital health strategies or tech-related advice. And then also, this paper is relevant because it positively contributes to research. As I mentioned before, it's bringing out important key ideas that have been previously ignored. So there are very few papers that exist with this context and with this theme. So this paper actually provides a positive contribution to research, and it could encourage discussions amongst end users. The paper was written in such a way that an average layman or a regular person would actually have genuine interest in reading the paper and engaging in a discussion, because finally they feel, included. They feel that there's this form of welcomeness, in the sense that we're talking about people who just love to work out. They love to engage in recreational activities, whether it's in the gymnasium or out of the gymnasium. So it could bring an open room for discussion amongst this kind of people. And finally, the last but not the least, is that it could generate important information for, amongst key industry players and other stakeholders and policymakers, in the sense that if we're able to find or highlight certain things, it could actually contribute to, the creation of certain policies that would either improve tech literacy or the adoption of technology in these African countries. So what is health promotion? The definition of health promotion backdates to the Ottawa Charter sometime in the 80s, but the World Health Organization defined it as a process of enabling individuals have greater control over their health, and they could improve their health by themselves. So there's this form of self-empowerment where an average person, an average Joe, could actually say, oh yes, I can do something about my health without bothering my physician. I can go online and I can check by signs and symptoms and actually give myself some advice. All right. So that's the basic foundation of what health promotion is all about. And then it could further be discussed within several principles which are mentioned here. And these principles, like having a broad and positive health concept, participation and involvement, action and action competence, a certain perspective, equity in health, in all these principles talk about health promotion being in a situation, a scenario where there's accessibility, all right, regardless of gender, race, or any other inequality or disparity or population. There should be a system where every individual should be able to take action on their health. And you cannot do this without actually providing them information, all right? Telling them it doesn't matter what the health condition is, it doesn't matter what it is, it doesn't matter what your age is, it doesn't matter where you're from. We can actually, communicate important health concepts to them. And then it's not just about communicating and telling them what to do. No, it's not about telling them what to do. It's about making them actively, involved in the sense that they know that they can take action, participate, all right, and actively participate to promote their health. So there's this relationship and there's this oneness between end users in the sense that they can make decisions for themselves and also have a very healthy relationship with the healthcare team. All right. So there's a reduced burden on the healthcare team and there's increased awareness amongst individuals themselves. And then here we have the conceptual framework for health promotion, and I'm not going to go into it, but it talks about conceptual approaches and strategies for promoting health in the population. And this narrative review focuses on the healthy promotion. All right. It's a very lame assumption in the sense that it's very lame to assume that every fitness enthusiast or recreational athlete does not have a pre-existing disease condition. But the paper posits that recreational athletes or fitness enthusiasts are individuals who participate in these activities and sporting activities or in gymnasium activities for the love of it, not necessarily because they have pre-existing disease conditions. So we categorize them under the healthy population. And the approach for health promotion is really different. We want to promote healthy lifestyles. We want to see how we can use digital health technologies to promote and encourage what they're doing. We want to see how we can use digital health technologies to ensure that they do not engage in unhealthy practices to meet unrealistic body goals. We want to see how we can use digital health technologies to prevent risk factors and prevent disorders and health problems. We want to see how we can use digital health technologies to also monitor their movement and give them information and feedback on the activities that they're doing, which they love so much. So the narrative review, this particular narrative review, has a very different perspective of looking at research, which makes it pretty interesting. And then when we're talking about digital health promotion, we now understand what health promotion is all about. But digital health promotion has a slightly different premise. It's just the same thing, but with the digital in the sense of it. So it's an extension of health promotion. So all the concepts of health promotion that I've talked about, self-empowerment, equity in health, having a broader perspective, not having restrictions on demographic populations and geography, digital health promotion it permeates into all of these concepts, but with the addition of digital health technologies. All right. So how can we apply technology to promote health? All right. And we want to be able to do this because we want to have access to a variety of populations. And by increasing accessibility, we understand that people in rural populations have access to technological tools and they can use it to, for the recreational activities that they are engaging in. We want to ensure that they are literate about the forms of technologies that are out there. We want to also ensure that they're actively engaging and then they trust the system, because whatever they're doing, we have to ensure that we take their consent, and that they've consented to whatever data is being collected. But then again, they trust that they are safe and secure. So that is how you actually have a successful digital health promotion framework. But then again, if you want to, assay the fitness culture in entirely, and we all already posited that we're focusing on Africa because Africa is part of the African countries have been ignored in literature. The fitness culture in Africa is really different when you compare it to other European countries and the United States of America, for example. I said the paper that we wrote actually talked about individuals, 1 in 7 residents in the United Kingdom being a member of a gymnasium. Okay, and then it's saying that another study conducted in the United States saying that fitness-related accounts on social media and 50% of those participants using those fitness-related accounts actually participated in a workout routine or some activities because they saw it on social media. So, this perspective is actually really different when you look at it in Africa, because we find out that recreational activities are part of traditional sports. And with all of that, we then have a high percentage of consumption of traditional supplements and weight loss pills to facilitate these fitness cultures in Africa. And then one of the studies we actually highlighted in the narrative review was the one conducted to investigate the perception of weight and how it was being managed by students in southwestern Nigeria. And we from the paper, we understood that most people actually took the laws into their hands and were very actively encouraged about doing something about their health because they had a false perception of their weight. All right. People who thought that they were, regular weights turned out to be overweight. All right. And then some people were extremely underweight and they felt that they didn't need to engage in any fitness activities. And then again, there were poor gymnasium activities due to financial and societal constraints. And in the midst of all of this, there was no information on how technology could actually help them to, at any stage of their lives in relation to their weight and how it was being managed. No information on tech adoption and no information on tech literacy. And this is actually a very big flaw. So when we're talking about all these things, we cannot do this without talking about the actual technological interventions that are being used. The paper, our narrative review, actually highlighted some of them, such as one of them that was being discussed in the paper by Connor, where we mentioned the use of virtual reality. We talked about online coaching. We talked about mobile applications. We talked about wearables. We talked about the Internet of Things, and the most interesting things, that are being used right now, like fitness trackers, and how the use of all these technologies increased during the COVID-19 crisis. But it's interesting to see this use, but very little information in Africa. Like in South Africa, for example, there is a wearable fever in the sense that new wearables come to the market and individuals just buy these watches and they, especially Gen Zs and millennials, like there's a higher tech adoption rate among this age group. But then again, there was very little relationship with fitness enthusiasm, and there was no guarantee that the buying of these wearables or downloading of these mobile applications actually led to an improvement in their health. There was no literature to support that particular claim. And then in Nigeria, we saw there was poor literature, and there was a report that published most downloaded mobile apps in Nigeria, and none of them were related to fitness. And then we found out that generally in Africa, when we're talking about virtual reality, it's almost not there. We can see the use of social media, and it's getting very popular, it's getting better, but then again, there's very little literature to support these claims. So since we are talking about poor literature, poor tech adoption, poor tech literacy, what are the strategies then that we can use to encourage the adoption of digital health technologies amongst this particular population that I'm talking about? First of all, we need to understand the target population. How is Africa? How are these, the rural and the urban areas? What are their socio-economic and socio-political climates like? We also want to leverage existing guidelines, strategies, and frameworks, and then we want to encourage interdisciplinary collaborations. We want to collaborate with the government, we want to collaborate with cultural centers, with religion. We want to also create synergistic policies that would emphasize facilitating physical activities in urban planning. And this slides actually talk more on different strategies. And then, of course, the limitations of the study, I have highlighted some of them already during the course of discussion, in the sense that there's limited literature and poor focus of literature on fitness enthusiasts and recreational athletes themselves. So I do sincerely hope you understand and love this paper. It would have been interesting if we could find available literature exploring different perspectives of fitness enthusiasts in different countries in Africa. It would have also been interesting to see if the similar work has been done somewhere. But then again, this encourages some form of discussion amongst regular end users and policymakers. Thank you so much.